The concept was we wanted to be able to train physician leaders, people who were adept at healing people, individuals, preventing disease in individuals, but also had this capacity to think systemically, to think about the problems of healthcare in society, and to reform healthcare in society.
Medical education can be very dehumanizing, and so what we'd like to do is to take care of our students in a way that they maintain compassion, maintain their own humanity, so that they are able to understand and relate with other people, connecting them to potential role models, and helping these students understand the field of medicine from actual experience.
It's people who are very good doctors to treat people and prevent diseases in individuals, but also people who understand the social situation and who see poverty linked up to health and will try to address poverty issues through healthcare. The double degree, it's an MD, MBA. MD stands for Doctor of Medicine, MBA, Masters of Business Administration. And therefore, the MD degree provides them the skills to actually be good physicians, to treat individuals, to prevent illness in individuals. The MBA gives them the foundations to understand organizations, to understand institutions, their financing, the way they're structured, the way you might have to reform them. So these are two very different skills. The skills towards the individual and also the skills towards organizations.
We want them to make a difference where most doctors don't go. And we want them to work in institutions and systems, because in the next 30 to 50 years, these institutions will carry on the task of reforming and changing the health systems and health structures.
When we say healing society, we actually mean trying to transform the way we approach healthcare in society. We cannot approach healthcare through medical missions. We cannot approach healthcare by calling the poor people to a clinic and giving them handouts or medicines. We have to think systemically. We have to think about how the system is financed. We have to think about how we are training all of our health professionals and healthcare workers in providing the services. We have to think about how our institutions are structured. We have to think about the private and public contributions to this system. So all of this needs to be put together in order to approach transforming healthcare in society.
Because of this challenge of treating the patient and treating the whole system at once, it constantly gives me that push to make things better for this country.
You know, many people, I think, go to graduate school, say get an MBA, because they expect to move ahead in their professions and, to be honest, to become rich. We're more demanding from our professional students or our professional schools, I think, because we're trying to say to them, you have to ask yourselves the question, why are you good? For whom are you good?
We are always inviting people to go beyond the merely personal or individual, and to see our connection to a greater and common good. In a way, we are an archipelago, and so it is a difficult struggle. But we need leaders who can actually bridge these tribal loyalties and connect us to one another.
The doctor of the future must understand that you need healthcare for everyone. And this is the way the world is already thinking. Okay, it's not just in the Philippines. The gap between rich and poor in the world is so huge that the experts are saying we cannot just train the doctor who's going to treat the individual. You have to develop doctors who understand the big picture, who not only know how to treat the individual, but also know how to approach populations. And that's why this is what's different about this school.